Ladies and gentlemen, good afternoon to you all. I am Rabbi Darko, a counseling psychologist with KNUST Counseling Center, and a member and secretary to KNUST Wellness Center as well. Please, those of us joining in, let's try our possible best to mute our microphones, please. Good. On behalf of the chairperson of KNUST Wellness Center, we would want to welcome you all to this month's edition of Psyche Gist. In fact, we've had previous sessions which have been so awesome, and we believe that this month's own, that's today's own, will be extra awesome. Let me put it that way. Before we introduce the speaker, we want to give some few announcements. This Psyche Gist webinar is brought to you by the KNUST Wellness Center in collaboration with the Behavioral Science Department and KNUST Counseling Center, as well as St. Patrick Wellness Clinic. Today, we're going to talk about addiction behaviors and drug addiction. One of the serious behavioral challenge our generation is facing currently is addiction. And to help us, explore more, delve deeper into addiction behaviors and that of drug addiction is a seasoned clinical psychologist named Miss AKUA AFRIYIE ADDAE. Let me give some few bio data of Miss AKUA AFRIYIE ADDAE. In fact, she's a clinical psychologist with several years of experience in providing various kinds of psychological services for clients of various backgrounds, such as those affected by addiction, depression, anxiety, relationship problems, and other mental health issues. In recent times, she has been focusing on producing trauma and grief counseling for victims of abuse and their families, as well as bereaved families. Ms. AKUA is currently the head of training, internship, and outreach at the Kwame Nkrumah University of Science and Technology Counseling Center, in short KCC, and a part-time lecturer as well. She is currently a member of the Mental Health Review Tribunal of Ghana and Accreditation Committee of the Ghana Psychology Council. She has worked with and provided training and consultancy services for various local and international organizations. These include the International Organization for Migration, Girls Education Initiative, Chance for Children, National Service and Mass, Quiz, Electricity Company of Ghana, and Ghana Statistical Services. She is a proud member of the International Society for Substance Use Professionals, American Psychological Association, and Ghana Psychological Association. This is a clear indication she's the perfect person for today's webinar. Ladies and gentlemen, to help us explore more into addiction, let's welcome Ms. AKUA AFRIYIE ADDAE. Thank you. Ms. AKUA, please, you can share your screen.
Thank you, Rabbi, for the introduction. And hello, everybody. Can I see a wave? And usually I do an exercise with the group whenever I do a presentation on addiction. I give them a little measure. But today I would ask for one or two experiences, and then I'll skip that. So what I want to know is if anybody has had an experience with somebody dealing with any form of addiction, and how have the entire family or people around been coping? Anybody at all? What has been happening in the family? What's been going on? The impact on their lives? Let's hear it. Anybody have a story to share for us to start?
Please, if you have a story, you can just unmute and you share your story. Thank you.
Nobody has a story. If nobody has a story, Then I'll go and give you an assignment for a few minutes or a minute. But this is what we'll be looking at. We'll just be looking at addiction and addictive behaviors. We are not going to go so much into details to the science of addiction and the medical aspect. We're just going to look at life around the issues of addiction, you know, and things like that. But we'll also look at the criteria for addiction. We'll look at what you call the addiction cycle when people want to change. I think a lot of us have had frustration with people. We know that they have some issues with addiction and want them to change and they are not changing and all that. So we'll look at that, and we'll look at how to help people with addiction. Maybe if you are everyday person, what would you do? If you yourself, you are struggling with addiction, some of the self-help tips. And for those who are, say, if you're a counselor or anything, some of the issues you can look at when you are working with somebody with addiction. We are not really going to go so much into details. And I want us to be, I know we'd have time for question and answer and all that, but usually I like things to be interactive. Right. So now, because nobody answered my question, oh, sorry about that. Because nobody answered the question, then I'm going to ask this one. So wherever you are, try to answer this question by yourself. Maybe, do you know somebody, or you yourself, you have been trying to cut down, maybe drinking, smoking, whatever, betting, watching pornography, masturbation, phone, the way you use your phone and all that. Have you tried to cut down on that? You've been trying to do that, and perhaps you find yourself going back. Number 2, have you felt angry when others complain about the behavior? So the people around you, your co-workers, your fellow students, your family members, they are telling you to change, and then you feel irritated about that. Okay. Or even felt guilty that after engaging in the behaviors that we have listed above, for doing that. And if it's drinking, or even if it is maybe phone addiction. So the first thing you do when you get up is to, go over and then go and take some in the morning, early morning, to get rid of a hangover. Or maybe if you are betting or gambling, you felt the need to continue doing that, Now, these are 4 basic questions. If you answer to 2, we are not saying you have an addiction, but there may be a problem. So then you start, it's very important that maybe you talk to somebody, for help. So that's the first thing, it's an exercise. Since I did not get a response. So let's look at some of these terms. Terms like substance use. When we are talking about substance use, we are looking at substance in general. These are, it can be a medication, it can be anything, it can be psychoactive drugs. In fact, when we talk about psychoactive drugs, which is the main thing that we are looking at, are drugs that actually work on your sort of your brain and your nervous system, and have effect on your emotion, the way you perceive things, how you feel, and how you act. Drugs like that. That's what we are talking about. But when we are looking at a substance use, we mean a consumption of alcohol or drugs. It may not be a problem. Then there's this issue of drug misuse. that we also hear about. So it can be that the one that we go to the hospital, we are prescribed medication, and today I did not take it, so tomorrow let me add another dosage to make up for, what I missed yesterday. So this one, you are not taking the drugs the way you are supposed to take them. And it's in regard to what you call your prescription drugs. Now, the one we are interested in is substance use disorder. In fact, I put the word drug abuse. The drug abuse per se is not, if you look at our manuals, the manuals that the professionals use, you will not see drug abuse. Drug abuse is in the main, how do you call it, the general population. So we would use something like substance use disorder. Okay, but it may be referred generally out there as drug abuse. That's the common language people use. And it's a complex condition in which there's uncontrolled use of substance despite harmful consequences. And that is what we are going to look at. That people are using substances, people are doing things to their bodies despite the negative outcome. But then, yes, but then we would have the term addiction, which now you can see it in, let's say, the DSM. There are terms I may use. The DSM, for example, is a manual used by psychologists, primarily those in America. A lot of us in Ghana are here. Then we have what you call the ICD. The ICD-11 is the classification of International Classification of Diseases, and that one is by WHO. And so for the ICD, for example, covers every other disease, but there's an aspect that covers what you call psychological problems. So in fact, we'll be using terms from these books or these manuals. So we are going to talk about addiction, but I want us to look at the substances. The substances that we are addicted to are the drugs and things like that. But we are not only addicted to substances, we are addicted to behaviors a lot. And especially when it comes to our young men and our students, there's a lot going on around. And so when we're looking at addiction, we are looking at it from both drugs and behaviors. And in fact, what has been found is that these behaviors work or interfere with normal brain structure and function in the same way or in similar fashion as when you use drugs, you see. And so the mechanism or the process that goes on with addiction or substance happens when you use or you engage in such behaviors. And so an addictive substance or behavior is any substance, an activity, object, behavior that has become a major focus of a person's life to the exclusion of other activities, or that has begun to harm the individual or others physically, mentally, or socially. In fact, when there's addiction, you realize that addiction is not an individual issue. It's a family problem, it's a societal problem, because the people around the individual suffer. And as I've already said, we can be addicted to substances or behaviors. If you look at the DSM and the ICD, these are the group or the classes of substances that are mentioned. Alcohol, caffeine. The DSM will tell you that the disorders that they are describing, they all apply except maybe caffeine. So caffeine is a little bit on the outside, but alcohol, caffeine, cannabis, hallucinogens, inhalants, and a lot of our young people. I mean, the other day, I had them telling me all the sort of things they've been inhaling, and I was like, wow. Petrol, kerosene, glue, the sort of things they are inhaling. Somebody said even shoe polish. They are just inhaling them. Opioids are the painkillers like the tramol. Sedatives or hypnotics or anxiolytics, the stimulants, tobacco, and others. So if you look at, for example, the drug classes, they perform certain functions in the body. And one group called the depressants. When something depresses, it means it slows things down. So it acts on the nervous system by slowing things down. So you see that the person's reaction to time is slow. That's why they appear very groggy, they are easily fatigued. They look like slow like that. So it's like when example is when somebody is drunk, taking alcohol or, Valium. Then the stimulants are, see, the depressants take you down. The stimulants are the other way around. So they speed up the brain and body operation. And some of the health impacts you can see are that there's rapid heartbeat, increased respiration, heart attack, and all that. So your cocaine, your nicotine, they are all here. The meth is very, very, very serious. And these days, it's very common. It will surprise you. I didn't know it's become that common. In fact, my assistant showed me a lot of pictures and some of the things our students are taking, to the extent that these days they've made them into even balloons, the inhalants, balloons. It's as if the individual is blowing balloon, but then he's inhaling a lot of things. And of course, the hallucinogens, those that alter your perception, what you call the psychedelic drugs, like the LCD. When you take them, they really act on your nervous system, then your temperature and rises and things like that. And that is when you start seeing things, you start hearing voices, you take the drug and you start seeing all those things. Yeah. And then we have the dissociatives. If you are dissociated from something, there's detachment. It's like the body is separated from you. So things don't seem real to you. So here you can see the individual being disoriented, the speech is impaired, they have difficulty with memories. Example is ketamine. Then the opioids, which are very common in our society, very, very common. In fact, they are supposed to be the painkillers, and they are good when used well, But then we've seen how our young men and our young women are using them. What they do is that they create drowsiness, insomnia, collapsed veins, and it can be so serious that the individual can enter into a coma with these things. When you go to the hospital, for example, a lot of our hospital personnel are addicted to morphine. They're addicted to morphine, And of course, I've talked about the inhaler and what our young men and women are doing. From a psychological perspective, I'll talk more about the behavioral addictions. Technically, the behavioral addiction, there are many of them. People describe so many, like the phone, even food addiction. There are so many of them. But when you come to the DSM and then the ICD, for example, DSM talks about only gambling. DSM talks about only gambling. And the gambling, for example, when you go to the ICD, to say the online and the offline, ICD will add gaming as part of it. So there are so many addictions, but these are the two we see. On the other hand, we also have, like I said, a lot. And for our young people, issues about sexuality. So pornography, masturbation, they cannot deal with it. The shopping addiction is not quite common in this part of our world. This is not quite common in our world. You know, exercise. And as we go on, we realize that some people even change or they substitute one form of addiction to another. Now, so before we start the next session, I want to find out or go back to the experience sharing we are talking about. That has anybody met somebody who has this issue or struggling with it themselves? You know, what are some of the common ones you found around? Let's share ideas about that. Anybody? Rabbi, I'm sharing my screen and I've minimized the other part, so I can't see a hand up. So I think that you would have to do that for us.
Sure. So please, if you have any comment, any contribution, just do that for us. Just show us your hand and talk any experience. Please, the floor is open. Auntie AKUA, I suggest you continue.
All right, okay. So the question is, how do you determine that somebody is having an addiction problem or somebody is addicted to a certain substance or a certain behavior? And by the way, before I do this, let me say something. I want to say something about the betting. You know, I think that betting has become very common in our society, that everybody is doing it. And so people are seeing it as normal. I tell you, if you know the havoc is wreaking in people's homes, to surprise you. We think that, oh, everybody around, because sports betting, everybody is doing it. Oh, so I'm not addicted. Oh, it's normal. And people come up with different questions. For example, somebody was telling, Madam, that is what I used to pay my fees. I said, all right. What about the harmful consequence? Have you tried other forms of even getting money to even service your fees? You know, but because what we've realized is that it's causing a lot of problems. But we have come to accept that. So how would you know that somebody has a problem with addiction? These are impaired control, risky use, social impairment, and pharmacological behaviors. And I'm going to explain that. For the first one is impaired control. You realize that the first question I asked when I gave the exercise, that have you had the opportunity or have you been trying to cut down and all that? You see, now when people are having an addiction problem, one of the things you see, whether it's gambling, whether it's pornography, whether it's a drug or anything, what you use is that they take larger amounts of the substance or behavior than intended. So, oh, I'm taking 1 thought, 5 thoughts. I'm staking 5 CD. Before you realize, I've staked 100 CDs. All the money in my Momo account is gone. If you are doing that, you have a problem. I'm spending 1 hour on my phone. Before the whole night, I am on my phone. I can't put the phone down. So larger amounts or longer use than is intended. Then the desire to cut down or stop. So usually a lot of the people, when they come, they will tell you that I've tried several times to stop, but I keep going back. they realize that it's not good for them. So they've done that a number of times, but then they will come back craving. We'll talk into details about craving. This is, in fact, you can use craving as even a measure to see whether somebody is recovering from addiction. The person yearns for the drug or the behavior and can't stop. And then there's a lot of time spent on obtaining, using and recovering from the effects of the substance. So you realize that this individual, if it is an alcohol, 4 a.m. he's in front of a blue kiosk. He has to go and get it. If it is gambling, he's doing everything. For example, there's this boy who came, who is, you are an orphan. Your grandmother, who is a pensioner, is the one that is taking care of you. You have gone round to make sure the people your grandmother owes, you are taking the money only for you to go and use it to bet. Not only that, the other things is because he stole his grandmother's money to bet. So and then when they are, even if it is alcohol, when they are drunk, look at the effect on them. Sometimes at the end of the day, they destroy the sort of relationship that they have. Now, so the craving that I talked about, cravings are usually that is that urge, that desire to continue to use the substance. And craving, actually, what it does is that it takes over the whole person's life. So, for example, we ask that, has this behavior or has this drug overwhelmed you so much that you can't do anything, you can't think, you can't function without it? And everything you are doing is going around to satisfy that craving. And cravings can be brought about by virtually everything, the sight and sound of the things that trigger the craving. Okay, so a trigger can be a situation. So maybe if you have a problem with pornography, you see a nude picture, you are browsing your phone, and then those advertisements, those things, that the pop-ups, it's a trigger. Immediately you go to the website, and then you are there, you are at the porn site. Sometimes the people, if it's drinking, even the people you drink with, the people you bet with, the people you gamble, immediately you see them, they are triggers. Passing by the joints, going to parties. In fact, in our society, funeral, somebody goes there, that is it. I'm sure we've all been to the village, been to funeral, where we have that man or that woman who is always dancing, always drunk. Yes. And I remember a group of friends, and we were saying, hey, wherever you go, you find them. Cravings can also be triggered by emotions. So people will tell you that it starts when I'm stressed, when I'm bored, when I'm hungry, when I'm lonely, when I'm tired, even when I'm happy. So in helping people with addiction, it's very, very important that one of the things that you help them with, or even if you yourself, is first identify your triggers. They are very, very important. And you have to note them down. You have to note that, and that this is the thing that pushes me, or these are the things that push me. And so when you do that, then you can avoid or do anything in place of those things. Right, so, and then the other one is risky use. That is engaging in the behavior or taking in the substance in dangerous situations. Look, I had a boy, I put this example here just to remind me. There was one boy who came to my office and said, Madam, I can even in lectures on my phone, I'll be watching pornography, knowing that others are there and you'll be caught. We've all heard our students using their monies, their fees to what? To bet, to gamble, instead of paying the fees. That is a risky situation, because if the university decides that you are not writing exam because you've not paid fees, what do? Somebody can exercise and exercise and exercise to the point that, I mean, the exercise can be detrimental to them. They still don't mind. And then continue use of the substance in spite of physical and psychological problems. Doctors have even told them that you have liver cancer or liver failure. Still, they'll go on drinking. See, the thing is that when there's addiction, there's impaired control. You don't have control. You have no control. And so you are exhibiting all these. Then, of course, social impairment. That is failure to fulfill major obligation. So we have students who are not coming to lectures. Somebody will come and tell you that, somebody was telling me that he does it in America. The online thing he's following is in America. And so the whole night he doesn't sleep. So he's not going for lectures. So during the day, he is now sleeping. People's work suffer. In the house, because of addiction, their obligations are not being met. Fees are not being paid. Chores are not being done. Assignments are not being done. Then you know that there's a problem. And then the persistent use, despite social or interpersonal problems from the effects of the substance or the behavior. So there's a fight in the family. The woman is saying, stop drinking. I mean, we've had problems, marriage issues, where the man is addicted to pornography and it's affecting their sex life. It's affecting the relationship. The man can't stop. So there's problem in the home or among other family members, and giving up important social occupational activities because of the substance or behavior. Things you have to do, you cannot do them because you have an addiction. And the final, the final criteria to show that somebody has an issue with an addiction is what we call the pharmacological criteria. And that is tolerance. I think we've all heard about we've heard these words: tolerance and then withdrawal. Tolerance in the sense that if I was taking 5 thoughts, now I need to take 10 thoughts. If I was betting, I started with 2 CDs, now I've gotten to a higher amount to get the same feeling, to get the same high, or marked by reduced effect when the same amount is used. So that now, if I take the 5 thoughts, it doesn't do anything to me. I had this, in fact, for example, those who do the pornography, you know, somebody came, he said, Madam, first when I started, I was watching pictures. It got to a time when I watched the pictures, they were not doing anything. So videos. Then it started to live recording of females. So the ladies are bathing. To go there, put the phone and be recording so that you come to his room and watch. Because now, when you watch the pictures, he doesn't get the same feeling. So that is tolerance. And then withdrawal. Withdrawal is when you are not using the substance, how do you react? So there's physical symptoms and psychological symptoms. I don't know, or I'm sure we've all seen. You see, people who have issues with alcohol addiction, early in the morning, when they wake up, see the way they shake, they sweat. Because at that time, the drug is not in their system. And so, physically, they act that way, you know. And psychologically, they become restless. They are biting their nails. They can't concentrate. They can't do anything. I think, was it last year? We had somebody come to our office. It was very terrible. My head and I, at that time, I was like, the withdrawal symptoms this person is experiencing, we should have taken him to the hospital. I was saying this one, in fact, I was scared the person was going to die. Yeah, it was very terrible. Yes. I've talked about craving already. So I don't think I need to belabor the point here. But what I want to say is that craving, can occur at any time, but more likely occur in the environment or situation where the substance previously is obtained. You see, psychologically and biologically, there's an association there. When we do how it affects the brain, we understand. For those who are psychologists, we know there's a what we call classical condition. There's an association. So, for example, if let's say that I drink with somebody, anytime I see that person, there's an association formed. And so then I begin to have that craving. Right. One thing I want us to understand, in fact, these days we don't see addiction as a moral problem. And somebody was sitting in office, Madam, some people even come and they say, Madam, I decided the day that I'll stop watching pornography, and I did. And I said, very good. But you see, it's not everybody that can do that. In fact, when it comes to how do you call addiction, there's even a genetic component. And so it is not everybody that can just stand up and say, I have stopped drinking. No, because of the effects on the brain. As we all know, you see, God or nature has endowed that with certain brain functions or brain activities that help us to survive. So, for example, there's a part of the brain called the rewards system, or the reward center, that when it's activated, you are motivated to engage in behaviors that are good for survival. So, for example, when you are hungry, you have to go and eat. And there are chemicals in the brain that helps us to do all this. And one of them is one chemical in the brain that is responsible for motivating us to do all these things. It's called dopamine. And so when even as normal human beings, we need this dopamine to be able to, be motivated to do the things that we do. When we take in drugs, what happens is that these drugs shoot up the dopamine levels in our brain. For example, if you take meth, it goes more than 10 times the amount that you need. And so a time will come, a time will come when you take this, the pleasure or the sort of euphoria that you get, you don't get it that way. And so your brain begins to adapt. The brain begins to change, to get adapted. And so it gets to a time that you need more to be taken to feel a certain way. And then with time, you just have to need it to become dependent on it. The issue is that, and not to bore anybody with technical details, what happens is that addiction leads to changes in the brain. And as I said at the beginning, even the behavioral ones, you are gambling or you are betting, you think it has no effect. Its effect on the brain is similar to somebody who is drinking, who is taking cocaine. And so we have to be very, very careful. So I put here the addiction in the brain, the effect of addiction on the brain, and what happens. Now, usually there's an addiction cycle. What we want to say is that there are changes in the brain when we become addicted. I want us to take this cycle that is shown here. What happens is that, and this is people, when people come, these are some of the things they say. So, for example, they see somebody that they drink with, or there's a thought, or they are bored, then it triggers a craving in them. So when the craving is triggered, then they will do all the sort of things, the behavior they have, sometimes do anything to get it, to get whatever, is a drink or whatever behavior, and then they use. And then when they use, a lot of them, what happens is that they feel guilty, especially those who really want to stop. And the point is that as they go through this, the structures in the brain are also changed. So for all of us, let's look at this very well. There's a trigger. The trigger can be anything. You remember the triggers of craving, whatever, your situation or whatever. And it causes you to crave. And then once you are craving, you want the thing more, you engage in behaviors that will let you go for the drug or engage in the behavior, and then you go and use it. Then after you use it, then there's what we call guilt. So that is a little bit. Now, what I wanted us to focus on is now helping people, or we ourselves doing stuff to help ourselves to overcome the problems that we have, even if you have not sought help yet. But these are some of the issues that happen when we have to maybe start taking the steps. People are in denial. People, they tell you all sort of things. I'm sure you are around people who say all these things. And I am going to skip this slide because it will appear in when we want to take the step to even change. Some of these things we tell ourselves, they are them. Now, to go for treatment, there are various kinds of treatment. Usually, combination is better. So the medical, whatever, you go, you do a detox, they give you medicine and all those things. There's counseling or psychological help available. For us in the counseling center, that is what we do. Sometimes we have to refer you to go for detox and other things. People are doing the 12 steps program, Alcoholics Anonymous and all those things. As I said, you can be treated on outpatient basis, or you can go into residence, you can go into rehab centers for you to be treated. But for you to start, you have to decide to change. And to decide to change, the first thing is recognize that there's a problem. If you don't recognize that a problem, then that we would have difficulties. Then be prepared to change. And then you seek professional help. But the change itself is where the problem is. Why? The question we need to ask is, why do people try and change? They are not changing. We have all these, people are not changing. We want them to change. how can we get the people to change? For change to happen, it goes through a process. And because my time is up, I'll quickly run through it. Now, the first one is called pre-contemplation. You see, at this age, the people are not ready to change. That is why they tell you all those things. Oh, me, I'm not an alcoholic. If I want to stop today, I'll stop. Everybody drinks. Oh, don't tell me what to do. All those things, you know. At that time, they are not ready. So usually you can help by, if you're a family member, you listen to them and all that. For such people, there are ways to help them. Then from there, we go to contemplation. At this age, the person says, okay, the person says, yes, he sees that there's a problem. The first one, he doesn't see there's any problem. So he sees that there's a problem, then he starts thinking about it in a way, but no, he's not really ready to change. So he's weighing the pros and cons. Okay, do I change? If I change, what are the pros? If I don't change, what are the cons? You can do that, and then you shift so that you can help the person to shift to another stage called preparation. Here, they are ready. And this is where they may come to you. They come to, if you're a counselor, they are asking for information. If you have a roommate, a friend who is maybe smoking or maybe betting or involved in pornography, they come to you and ask questions. They are preparing to change and ready to. Right. And from there, then they take the action. They have actions. That means they have actually set a goal. We are going to do ABC. They've come to therapy. Then whatever they are taking through, this is where they are actually changing. And from there, maintenance. Maintenance is, who would say, recovery in a way. This is where they are recovering. Or the gains that they have, they are recovering. In fact, when it comes to addiction, for me, or you tell your client that it's one day at a time. Because in addiction, one of the things is that there's always the chance of relapse. In fact, relapse is part of the process. So you have people who come, they are very, very, very sad because they've tried and they keep telling themselves that I can't do this because I try over and over. Relapse is part of the process. You need to understand that. And so when there's a relapse, or what you call a lapse is where you make a mistake. You don't go back to, say, pre-contemplation stage, but then you can, just a little, and then you come back to yourself, and then you continue. And then termination, per se, we in addiction, termination is not 100%. I don't want to use the word possible, but people, let's say that there's always a chance that once in a while people can come back. So I'll skip this one and then give us some help tips. I mentioned earlier that you yourself, when you want to help yourself, one of the things is to identify your cravings, the pattern. Check what time on my body, for example, what time do I get the craving, the urge to go and do it? How long does it last? Because you have to understand that craving, it doesn't matter how intense it passes. It passes. So you need to understand how is the craving like for you. And so when you are able to identify that these are my triggers and this is what brings on the cravings, then as much as possible, you try to avoid that situation or you cope with it. Some of the coping mechanisms are distracting yourself in activities. Exercise is number one. Early in the morning, I have clients early in the morning 5, because by 5, 4:35, the craving has set in. Run. One of the things is that if you realize that thought patterns are involved, so if you are sitting in the room alone, you are going to have issues, and so there is more likely that the craving is going to intensify. You need to get yourself involved, be interactive with other people. Don't be alone. And then you go with the craving, means craving will pass no matter how hard it is. And of course, you do a lot of self-talk where you challenge the negative thoughts. I can't do this. I can't do this. No. With the help of affirmations and other things, there are times for example, if there are times you've gone before, you can use that to help you. Those who are doing 12-step and others, sponsors, usually it's good to get somebody you trust, especially if you're a student. Get somebody you trust, Sometimes when they come and I ask them that, would you like somebody to support you so that when you are having that, you can call on that person, talk to that person encourages you and all that. And then sometimes recalling the negative effect it had on you can help. Now, I'm almost done. Now, if you're a counselor, this is not to tell you what to do. No, it's just some issues that some just suggestions to incorporate in your sessions. If you're a counselor and you are helping people with addiction, one of the first thing to do is goal setting, because we have realized that people come and say, I want to stop drinking, I want to stop masturbating, I want to stop this, I want to stop this. But you have to set realistic goals. For example, if you are drinking 5 thoughts, maybe reduce to maybe 2 thoughts by this time. So you set goals that are realistic for you to follow, and you do that with your clients. Let them work out with work it out with the clients, and then take good history when it started, how they are doing it, how often have they gone without, for example, not taking. You have to do a lot of good history taking, and then the skills that you use to train them, you have them in your repertoire. And as I mentioned earlier, relapse and lapses are very, very important. You need to deal with that because the individual is going to face that problem. Then one of the things we have to do is, as I've said, we do a functional analysis. What are the conditions that are, for example, reinforcing this? What are the conditions, for example, that are making it go down? You have to do a very good functional analysis to get that. Now, when you are in therapy too, as I mentioned, the slips and relapses, they are very important. When they come, they will be beating themselves down that, oh, I tried and I was not able to do it. And so they feel very horrible. They feel very, very horrible. And you need to assure them that it's part of the process. One thing you also need to deal with is the guilt, especially in a part of the world, especially those who are Christians or religious people. They carry a lot of guilt that, for example, they feel they are the worst people, God cannot forgive them and all that. They carry so much guilt, and you need to work with them on that. And of course, work on their sense of self, their self-esteem is very, very, very low. Those are the things you have to look out for when you are counseling them. And also go on to look at whether are they replacing the addictive behaviors they came with others. So, for example, you see now, he's not betting, but he's maybe watching porn, or he's not gambling. But right now, he's doing something different. And that has also become a problem. So you need that. Now his phone has become his problem. So you need to find out that and work with the client to be able to deal with that. So in conclusion, what we are saying is that Of course, addiction involves loss of control. That is why it's difficult for them to stop. It has both psychological and physical outcomes. And of course, it causes major changes in our brain. And it can be difficult to quit, but there's help available. And that is why we at KNUST Counseling Center is encouraging you to come to our outfit. There are outfits out there, the rehab centers around. Look for them and then share them so that if you know anybody or you yourself are struggling, you can seek help. Thank you very much. So I'm going to unshare.
Good. Thank you, Auntie Kia, for that smooth and insightful presentation. In fact, I like the fact that you talk about the religious people. I remember a young guy entered my office and said, sir, I want to cut my mangood. I want to take it away. It is disturbing me. I can't even pray. In fact, thank you very much for that insightful presentation. Please, we will open room for questionings. Please, if you have any question, you can just put it in the chat room, or you can unmute and talk, or let us see your hand, call you, so that at least you can register your question. Please, the floor is open for questions, please. This whole program, Psyche, is brought to you by the KNUST Wellness Center in collaboration with the Behavioral Science Department, KNUST Counseling Center, and St. Patrick Wellness Clinic. Please, we are ready for your questions, please. And take care once again. Thank you very much.
You are welcome, Rabbi.
Awesome presentation. Please, we are waiting for your questions. Questions, comments, contributions, any experience you have encountered before, you can share with us. Good. Please, we are waiting for your questions. You can raise your hand, then we will call you, or just type it in the chat box for us. We have over 82 people attending this webinar, which is quite encouraging, but I think we can do more next time. Again, please, we are waiting for your questions. Any question, any input, contribution, comment, they are all welcome. You can put it at the chat box or raise your hand. Let's see your hand and call you for your question. Again, we are having
quite surprising.
Sure. We are having a walk and aerobics this Saturday. You can pass through at the Wellness Center when you are coming. Come with all your family members as well. We are still waiting for your questions, please. Auntie, there's a question.
Yeah. There's a... Can you read it out for me, Mr. Rabbi?
Yeah. It says, great presentation. There is significant stigma with addiction, so it's good to have such presentation often. It may be a lifetime for someone suffering in silence. Okay, yes. That is a contribution. Thank you. Please, how do you help someone who relies solely betting, since the money given to him is not enough?
Yeah, this is a very good question. So I'm for the two questions. Thank you very much. The one saying that stigma, yes, stigma is very, very important. For example, we hear anybody that has issues with addiction and we label them. Because of that, they will not even seek help. And so it's very, very important that we should understand that it's a disease, and look at what is happening in the brain. And so instead of labeling people as weak or something like that, they will need our support. They will need our support so that they can seek treatment. Now, the other thing about betting, that relying on betting because that's the money given to you was not enough. So like I ask my clients all the time, first and foremost, have you thought of any other alternative to look for funding? In fact, when people come, they think that is the only alternative, but there are other alternatives. Two, weigh the pros and cons of doing this on your life, on your relationship? Which one do you prefer? Do you need to continue that so that you lose, for example, your marriage, your friends, whatever, or you will be willing to change and instead look at alternatives? I know that it is not that simple. As somebody told me in my office, Madam, it's not that simple. It is not, it is true, it is not that simple. But we can always work. Sometimes people don't see alternatives until we sit down in therapy and then they begin to see that, well, it is not as bad as I think. In fact, betting is not the only alternative. So if you are having that issue, I think come in and let's begin to look at the issues into details.
Thank you, Auntie Kia. There's another question. It says we have some questions coming in good. It says, in dealing with addiction, is it mandatory that the old one be replaced with a newfound addiction?
I didn't hear the question very well.
In dealing with addiction, is it mandatory that the old one, as in the old substance you are addicted to or the old behavior you are addicted to, be replaced with a newfound addiction? I think you mentioned that, yeah.
So that is what I was saying. That then that has also become another problem. So it means you are still addicted to something, you know. So you don't have to be addicted, change an addiction. No, then it's like we are in the same problem. So the job is to help you to be able to let go and find healthy or better ways of coping with whatever you are coping with, you know.
Okay, thank you. Thank you, Auntie Kia. Another question, please. Is using a drug for a particular illness not prescribed for you, but someone else, also termed as drug abuse?
You know, so we said drug misuse. So that one, we all know that if a drug has not been prescribed for you, why are you using it? The abuse is usually, that is a misuse. And in this way, I'm thinking he's talking about prescription drugs. That is drug misuse. Usually when they say drug abuse, yes, they usually mean substance use disorder. And we are talking usually more of, how do you call it, the psychoactive drugs.
Okay, we have an interesting question coming in. It says, in the context of addiction recovery, what role do prayers play in supporting individuals on their journey to sobriety? Additionally,
prayers.
Yes. What role do prayers play in supporting individuals on their journey to sobriety?
Right.
Additionally, yes. At what stage in the recovery process is it advisable to introduce prayer as a supportive practice?
Well, as a people, we are very religious and very spiritual. So for me, I would say that if you feel that prayer will help you, that's all. You can go ahead and incorporate it into whatever you are doing. But then let's do it with the other tested approaches as well. You know, as a country or as a people, based on our belief system, whatever we do, whatever illness even that we have, we add prayers. But the point we always stress is that as you pray, you add the other aspect so that you get holistic health. Okay. So as to where you can start the prayers, what works for you, the beginning, the middle, the end, is usually between you and your supreme being or whoever you believe in.
Okay, thank you very much.
And in fact, the 12 steps people, for example, you know, they surrender to a supreme being. Those that do Alcoholics Anonymous and all those things. Yeah.
Thank you. How can a person know that, for example, a sexual addiction is gone? Because some addiction seems to be seasonal.
All right. So you saw the criteria for addiction. So if you meet those criteria, you can control it. Where you have tolerance, where you have withdrawal. Even in sex, you can have withdrawal. If you don't do it, you are not okay with yourself. You know, that's why they go about doing that. So if you realize that the conditions we talked about, for example, doing it risky in public, you are going to do it, you know, you are in danger and all that. If you realize that all those conditions are not being met, the conditions that qualify for addiction are not being met, then you realize that, oh, for now, perhaps I'm in recovery. But as I have said, when it comes to issues of addiction, we take one day at a time. For me, that's what I work with my clients. We say each day at a time. For those in 12, the 12th, they can tell you have been sober for 256 days because it's each day. Because anything can happen, you know. Yes.
Thank you. Maybe we are taking the last one, then we can bring our whole webinar to an end. It says, please, it is said that engaging more in prayer and church activities work a lot in eliminating some addictions, since some can have some spiritual attachments. I don't know if it is clear.
Now, first and foremost, I do not know the spiritual connotations, whether addiction is by a certain spirit. I don't have the eyes to see that. I can't say that there's a spiritual connotation to that, no. But what we can say, you see, when you go to church, you are engaging in these things. Remember, I said, don't be alone. As you do this, it takes your mind off some of these things. You are talking with people, you are doing this. Usually, if you are struggling, you take a look. You realize that a lot of them, when you are alone in your room, for example, is pornography. That is when your mind then will start wandering, and then before you realize, you are on site, you are watching. But let's say if you are in church, engaging in church activities, talking with people, meeting people here and there, then your chances of, for example, your mind wandering, those thoughts coming back will be lowered. But as to whether it's a spirit that is causing it, I can't speak to that.
Thank you, listeners and viewers. I think we have to bring our whole webinar to an end. And we want to say a very big thank you to Ms. AKUA AFRIYIE for your time, patience, and delivery. In fact, we have learned a lot, and we believe that this presentation will go a long way to affect our lives and change our lives. If you can hear us and you are going through some form of addictions, please, you can pass through the KNUST Counseling Center for assistance, and we are there to support you. Once again, this whole webinar, Psyche, is brought to you by the KNUST Wellness Center in collaboration with the Behavioral Science Department, KNUST Counseling Center, and St. Patrick Wellness Clinic. Again, at KNUST Wellness Center, we offer a lot of services to staff, and interestingly, services like the psychological and counseling services and that of medical nutrition and diet therapy are all free for staff. So please, you can pass by. The psychotherapy session is on Fridays, while the dietitian offers services on Wednesdays. You can pass by for your free session. We also do what we call medical education. We pioneer creation activities for staff, and physiotherapy as well. So please, you can pass by to have your session with us. This comes Saturday, we're going to have a program. This time we're going to have with the SRC, work with the director of student affairs. You can pass by for us to have aerobics, enjoy ourselves, and socialize. Once again, thank you very much for passing through. We'll be looking forward to seeing you in next month's edition. So please don't miss it. Once again, thank you for joining us, and have a wonderful day. Bye-bye for now.